Hello. Welcome to Medical Mom Mondays 2.0. I had promised that I would speak about silos. I listened to a podcast that identified silos, and it identified how that exists for families like mine, families who have medically fragile, technology dependent children. Um, it's not the first time I've heard it. Interview after interview, people say, "Oh yeah, no, there's, we have siloed healthcare." But what I haven't heard yet is how are we going to change that? How does siloed healthcare go from, conversations around tables with doctors and nurses and families and caregivers and all of the consumers of healthcare? How are we going to change anything? Like, seriously, I've been in this for 20 years now, and it's the same pot. And there's a whole new generation of families who are bearing children or children who have acquired disabilities and diagnosis, who are going to be exhausted the same way I was 4 years out. That's the exhaustion of navigating those silos. And let me just say something here too. It's not just the silos, right? It's when we look at that care map that I talked about previously, where you have the central person and then you have, it's like a spider web, right? It all goes out. If you were to turn that and make it flat, but then make it three-dimensional, where each category came up, right? So then the parent or the caregiver has to go from one out the door, down the street, around, navigating all the things that are on the street to get into the next door, right? And sometimes, like, the biggest part of the exhaustion is just that navigation, not the silo itself, but the navigation between silos. I can't tell you the number of times that we were ready to be discharged, in early days. It's sure, okay, that's great, we're out the door, let's go. And then just to find out that the supplies aren't available at home, that services aren't ready for school, and that the medication's not available in the pharmacy. Like, hold on a second, right? That's labor. That's a lot of extra that goes into a simple, here's the plan. These are the things you just have to do. Everything's taken care of. Out the door you go. That's great. Bye-bye. No, it doesn't work. And so the end user, the patient, if you're talking about adults or their caregivers, but in pediatrics, the end user is also the support person, the only and often sole support person for the patient. So something's got to change anyway, something's got to change. And I would ask, in your healthcare experiences, I would ask to speak to managers. I would ask to identify what is the problem, what needs to change. Ask, how are they working towards changing it to be easier? Ask them, how can we leverage our political votes, our political voices, to even reach and speak with somebody about some of their concerns? How can you connect with other exhausted parents to discuss asking for change, or other caregivers, those organizations that will champion a pediatric parent caregiver? If you know of any, let me know, because I don't know of any. We're just sort of this group that just kind of keeps going on. We just keep trying to figure it out. So this is, there you go. There's my today's talk about silos and just how exhausting it is to the pediatric parent who has to juggle 10,000 things. And I don't think we need any more conversations about that it exists. I think we need conversations about how do we encourage action to change. So I asked you this question today. How do we encourage action to change, meaningful change, and meaningful consultation? Okay, thanks. Thanks for your time. Look forward to hearing what you have to say. Leave me a comment. Take care.